all the findings that we've just learnt about in this whole water crisis within the Bongo area and how it's impacting maternal health. It's quite a serious challenge.
Very serious. And the woman who said that she delivered and her sister had to bring water from the house before she could take a bath.
So sad.
Yeah, and I don't think this is right.
It's not right.
Last week I was talking about how we need to equitably deliver development across the country, especially prioritizing the north. How can you expect mothers to deliver children in areas without water, without any wash facilities? And if you listen to the description of the facilities they have, these are even not fit for purpose, all right? And they are the facilities that are available.
Yeah. You know what? I would also be interested in hearing the health implications, right? Dr. Srofenyoh would have to help us through that because there's no doubt that if you have such a poor condition in terms of water supply, that there would not arise the issue of health complications just for someone who wants to give birth. It's really a shocking situation, but I believe
yes, Doc is on the line and he's also seen the documentary. Doc, good morning, welcome to the Super Morning Show.
Good morning and thank you for welcoming me.
And I hope you are well this morning.
Yes, by the grace of God.
Where have you been this time? I know you used to be the past medical director of the Ridge Hospital. Where do you work these days? Are you still at Ridge or you are with a different facility?
Currently I am on the department, even though I still have interest in developing in that sector.
Doc, your line is breaking. If you can position yourself well for us.
Okay, is it okay?
Yes, I think it's okay now. It's okay now.
Okay.
So you've seen the documentary. Your initial thoughts after seeing the documentary and the experiences of these mothers and health professionals?
Thank you very much for bringing this issue across. The fact of the matter is that this documentary is a huge wake-up call because oftentimes when we talk about health facilities, we are often talking about big hospitals in big cities. It's often lost to us the needs of those in the very, very rural areas, and this is what this documentary seems to bring up. Water is basically critical for any health system to work. However, when it comes to mother and child services, delivery services, water is critical. Even though it's needed for hospitals generally to run, when it comes to delivery services, water is critical. So it's unfortunate that we have such a situation of where either the water is in the borehole and somebody have to go and fetch, the water is not channeled to areas of convenience for the mothers to use, and so on and so forth. So this is not a satisfactory situation at all.
Doc, let's get into the health implications. What are the hazards that you can immediately think of the story that you've heard, what these people are going through, and some of these challenges that they may face health-wise?
Thank you very much. Within service provision within the health sector, one of the things that we emphasize is infection prevention. That is, services must be delivered in such a way, in such a manner, that you don't carry infection from one person to another person, or get infection from the environment to a person. But in situations like this, where adequacy of water cannot be guaranteed, the water is not even flowing into a system where you can easily wash your hand, then this practice definitely will be compromised. So for me, that is the first thing, infection prevention, so that even though the health system is a place where you get clean service, you may end up being subject to an infection which shouldn't have happened. So for me, that is the first thing. And then during this thing came up that in one of the institutions, because of the pressure, there is not enough water. Immediately women deliver, they are asked to go home again because of lack of water. Normally after delivery, mothers are supposed to be observed within a minimum period of time to make sure that they continue to be fine before they are allowed to go home. But if they are discharged immediately to go home just because of lack of water, then the other implication is that the mother may get home and now experience certain complications which could have been detected and managed if she had been kept in the hospital and observed. So for me, these are the immediate things that come to mind.
How about standards? Because if you look at where all of these things are happening, they are within the inner communities or rural communities, if you want to call them as such. Don't we have standards, standard operating procedures for these CHIPS compounds or community health centers as to how they can operate, the need to have water on standby? Is that not part of the code that you operate with as professionals?
Thank you very much. Indeed, these standards you mentioned are part of the basic codes of operating procedures that we adhere to in health facilities. But here is a situation where the basic utility, which is water, is not available, either not completely available or not available at the right place or not available in adequate quantities. And so for the service, yes, people know services have to be provided, but the basic utilities that are necessary for those services to be provided at the best standard is what is lacking in this case, as your documentary has revealed. So yes, the basic codes are there. Yes, the basic codes are there. So the question is, do we close down the center? But no. The best thing now, as the wake-up call has come, is the authorities and the stakeholders to quickly run to this, to address these issues. As a nation, we have to work together to immediately address these issues.
We know that it's not the ideal situation. You are a professional who's practiced for so many years. At least you're on retirement now, so you have, memory of some of the trying times as a professional, health professional. What alternatives do you use in events such as these? I'm sure you've served in some rural communities as well.
Yeah. So thank you very much once again for this question. The alternatives, if you don't have water in order to prevent infection, the alternative will be the use of hand sanitizers, alcohol, and so on and so forth. But these cannot completely take the place of adequate water. For example, when the baby is delivered and the baby has to be cleaned, maybe bathed, so that the blood materials are taken away, as system to say, we need water. We cannot use the hand sanitizer. So the place of water in delivery services cannot be replaced by any other devices. And that is why we just have to take up this as a wake-up call as a nation and get them addressed.
And earlier today, I was just asking Kojo the question as to why it is the case that you go to all of our health facilities and in some cases, in most cases I should say, you'd have to buy your own water, either warm water or whatever it is. You have to be the one paying for them. Is it as a result of poor management, or what's accounting for that?
Thank you very much. I'm not sure about what you're saying. In the bigger hospitals where these services are easily available, like water easily available through the taps, the warm taps, and then the cold ones. The patients have access to these. It is when these services are not available within, and somebody has to maybe go home, warm water, and bring into the facility. It is such situation in which this kind of cashing in situation occurs. So the solution would be for the system to provide the appropriate sources of water within the health facilities. And then we can see all those things to be gone with the weight.
Now, Doc, if you look at the Ghana Health Service modular strategy for provision of infrastructure, the primary infrastructure is CHIPS compounds, which are usually manned by community health officers and sometimes volunteers. And then you come to the clinics or the community health centers, and then you go to the districts, hospitals, and then you come to the regional hospitals, then you move to the tertiary hospitals. If you look at the need across the rural areas, should we rather do away with CHIPS compounds as the primary and rather upgrade all our CHIPS compounds to the clinics where you can have your medical assistant, at least a midwife, and a couple of nurses with 1 or 2 inpatient rooms to be able to allow these professionals to do their work? Because the documentary we all saw, people are giving birth in CHIP compounds, and those are not facilities meant for that. So should we decide that as a country, CHIPS compounds are not functional enough, especially when it comes to the rural areas, so we should upgrade all of them to clinics and have at least a medical assistant and a midwife and a nurse man these structures?
Thank you very much. Well, this is a wonderful suggestion. Upgrading all the compounds to the higher level. And the question is, do we have the resources to carry out this upgrade? It's all because these compounds serve smaller communities, and so they are designed to be small. But the fact of the matter is that they should not be designed without the appropriate facilities. The emphasis should be on the basic utilities and facilities that are available, not the place. That should be where the emphasis should be. And so now that the wake-up call has come, we have to make sure, as a nation, the authorities and the stakeholders need to carry out rapid assessment and see where the appropriate resources can be deployed. I am not saying now to say that all CHIP compounds are upgraded clinics. Yes, I'm not in position to say that. That will be because the CHIP compounds serve certain purposes, supposed to be very close to the communities, where community members who have a health need can just walk to immediately and be served with basic services. Yes, so that will be my answer.
Thank you so much, Doc, for joining us this morning with your thoughts, sharing your experiences here, and deep insights on the Super Morning Show. We thank you so much for your service to Ghana. And
thank you.